I think that's a very interesting thing because, as we said, we're kind of stuck with, the people that had us and raised us. The big thing there, and actually it's a really good question because people tend to overemphasize that sometimes. We talk about it, we look in that situation. There are certainly some of the genes that's an up-and-coming area as well, looking at the genes themselves. And looking forward, there are certainly genes that are involved with our lipids, the cholesterol thing. There's certainly hereditary forms that are definitely more prone to cardiac issues, atherosclerotic issues. We see that. We query people about, hey, were there people, brothers, sisters, parents, aunts, uncles, who had issues at a young age? And when we talk about young, we are talking about in their 30s and 40s. Not infrequently someone will come in who's 70 years old and say, I'm very worried about everything. My mom had a heart attack when she was 78. That really doesn't have a lot of relevance. We're talking about premature things. Probably men in their 40s, 50s, which is sad because that's the prime of life, of course. Maybe even the 60s. Women in the same area, and that's and that's basically the thing. We really don't know. It's clearly multifactorial. Blood pressure issues that people inherit, certainly possibilities. Diabetes that people inherit again. All of these things do come into play. By no means is there just one specific area, from a genetic point of view. It's certainly the combination. But I do think people do get a little overly concerned as they get a little older and say, mom and dad had heart attacks and they were both 82. That happens. Biggest risk for heart disease I always say, is waking up the next day, meaning getting a day older. But I think we're just beginning to scratch the surface of the genomics and the genetics. I know that in any drug study, any kind of study where people are looking at things, they do take blood, and if you look at the consents, and I don't know what they do with it, somewhere along the line I'm sure they're running genetic profiles to try to see that. We also are looking at that with how people will respond to therapies, and that's not just in cardiovascular disease. I think we're just in the infancy of those things in many of our areas, not just cardiology.